October is World Menopause Month, and as we collectively work to build awareness around the realities of menopause, it's crucial to recognize the disparities in symptoms and care for Black women.
So joining us in studio to talk about this from Women's College Hospital is OBGYN Dr. Cynthia Maxwell and general neurologist Dr. Candice Todd. Welcome.
Thank you. Thank you for having us.
So, research is showing us Black women experience menopause differently than other women. Dr. Maxwell, how so?
It's such an important question. We now know from data that comes from the United States, a study called the SWAN study, that Black women experience the symptoms of menopause over a longer period of time, on average 10 years, compared to white women. And we also know that the onset of these symptoms is approximately a year earlier. So it's a longer duration and onset of symptoms of menopause. And this is relevant for Black women since since Black women carry a greater burden of chronic diseases, and there is overlap between the effects of menopause and long-term health.
Interesting. I would say, Dr. Todd, do we know why there are these differences in how Black women experience menopause as opposed to, say, white women?
The short answer is no, because we just don't have the literature or the research to back it. And then the study that Dr. Maxwell was mentioning is that study wasn't built for the Black patient population. It was done a long time ago and it was done in the US. But what we do know is there's something called social determinants, which is really a fancy way of saying, there's differences between Black women and our Caucasian counterparts, smoking, obesity, education level, and that it kind of leads to stress or inflammation in the brain and the body, and that can predict how we do later in life.
So you mentioned this, Dr. Maxwell. It's that sort of layering of your health status even as before you even enter the menopause transition. So what is the connection now between quality of care that a woman may or may not receive and then her experience of menopause later in life?
For Black women and Black communities in general, access to care is really the key here. It's about not only being able to see a provider, but being able to receive that care in a way that feels respectful and comfortable. Cultural sensitivity is a way to describe it. And the structural determinants of health, basically that means anti-Black racism. How people experience racism in the healthcare system impacts not only their ability to access care, but to even accept the recommendations and feel confident in the care that people are receiving.
And Dr. Todd, what are some of the ways she might receive a different standard of care?
Well, I think it comes down to a little bit of education, too. If we all think that menopause is just hot flashes and night sweats, we may just not understand that time of our life. And then the other thing is, to just get access to just see your family doctor is a bit of a challenge, taking time off of work. So many women are just going to choose to talk about high blood pressure or diabetes, and they're not going to be so willing or open to talk about pain, which is definitely stigmatized a bit in the Black community. So we have to really encourage patients to feel more open and be able to have those discussions.
Listen, menopause has been my world for many, many years, not just because I'm in it, but because I do podcasts about this as well. And one thing I've learned from a lot of doctors like you is there is such an education gap in medical school that there isn't sufficient training. It's changing slowly for doctors to just talk about menopause in general, but the nuances of difference in symptoms, early onset, et cetera, for different women. Are we making any ground, Dr. Maxwell, in teaching doctors the nuances of menopause?
Such an important question. There's definitely a gap because we know we don't have enough providers with expertise in menopause to provide the care that's necessary for all of our communities and for Black women as well. Wait times are 1 to 2 years in our region for some people to access menopause care. Health education, medical education develops or evolves slowly. We've learned in the past that the illustrations of Black pregnancy were some of the first we'd ever seen by Chidebere Ibe, and that it takes many, many years, if not decades, for our education to catch up. The good news is that the education is improving. Our medical students, our medical learners, and other health disciplines are being educated in menopause, so we will get there.
We'll get there.
Yeah. When we get there is the question, but as long as we're going in the right direction. So Dr. Todd, what do we know about the longer term health outcomes of menopausal Black women who are not adequately diagnosed?
So I'm a brain specialist, I'm a neurologist, so my focus is a little bit siphoned there. And what I'd say is chronic pain is definitely misunderstood and we don't talk about it. And perimenopause is a really hard time for many people who suffer from chronic pain that can get worse during that time. And then obviously, you know, memory, that's something that people really, cognition really bothers people, and women are more likely to develop Alzheimer's. So how we set each other up for the next 20, 30 years really is important.
So, Dr. Maxwell, you know, last word to you. How does a woman advocate for herself if she doesn't feel like she's getting the care she needs?
The health system does need to advocate for people, I would like to start off by saying, but I think individuals, Black women, can learn about menopause. They can feel empowered by that education. They can come to the Black Women's Health Summit that Women's College Hospital is hosting later this month. And I think that we need to get the conversation going and continue it. So let's get Black folks talking about menopause, understanding what it is, what are the symptoms, know that there are really effective treatments out there, and also maintain good, healthy habits, sleeping, eating, physical activity, to keep us healthy for decades to come.
Dr. Maxwell, Dr. Todd, thank you so much for stopping by and having this very important conversation. You probably enlightened a lot of people today. Thanks again.
Hey, you, come a bit closer. We've got so many more must-see interviews, spicy debates, lifestyle tips, and pop culture moments. So subscribe to our channel by tapping the logo below and don't miss out.